Welcome back to DBL. We've got our favorite doctor here, Dr. Coley. We want to talk to you about a couple of celebrities who recently passed and the causes of their death, starting with literally one of my favorite singers of all time, Sinead O'Connor. She died last July at the age of 56, and we're now learning that she died of pulmonary disease and asthma. So Dr. Coley, talk to us about the pulmonary disease that she had and how that contributed to her passing.
Right, we lost her so young.
So young.
You know? Yeah, and so this is a disease called COPD, chronic obstructive pulmonary disease, usually caused by smoking, but there can be non-smoking related causes as well. And two things happen to you when you have COPD. One, when you think about how we breathe, we normally take in a breath and then we exhale completely before we take in the next breath. In COPD, you have air trapping. So the air gets trapped in your lungs in little pockets, and so you start to kind of breathe on top of your breaths. So you can imagine how short a breath that can make you and how limited you can be with that. And the second is you have a lot of chronic inflammations. You have mucus production, you have destruction of the air cells, so you get a lot of sort of, you know, lack of oxygen, retention of carbon dioxide, the things that the lungs are supposed to do. You know, get you oxygen, blow off the carbon dioxide. So this affects all your organs, your heart, your kidneys, your brain, and it can really affect your life expectancy.
And she could always belt so strong. That's so sad.
What's,
The lungs, she would belt.
Exactly.
You know?
Such a tiny person.
Totally.
Too.
I mean, I see commercials for COPD on television for medications for it, and I wasn't really familiar with it, and I don't think the general public really is, but obviously it's a major killer. So what can we do to stop this from happening?
Oh, well, you know, smoking, I would say, is the biggest driver of COPD in the United States and worldwide. So if you don't smoke, don't start. And if you are smoking, you have to get off of it. Because my patients tell me all the time, if they could tell their younger self something, it would be to save your lungs. You know, because without your lungs, you can't walk to the bathroom, you can't get dressed, you have to be tied to oxygen all the time. It really affects your quality of life. So when we talk about aging gracefully, it's one of the most important things. There's also environmental pollutants that we, you know, have to try to limit our exposure to as best as possible. Some of us get occupational exposure, so it's really important, even if it's hot outside, to wear those N95 masks so we're not inhaling anything if we're working in construction, where there could be asbestos or other such materials that we work with. And then this is something we don't often think about, but infections can actually damage our lungs permanently. So RSV, for example, can cause asthma if you get it as a child, even as an adult for that matter. So really getting vaccinated, making sure we minimize our chance of infection, keeps us, you know, our lungs feeling so healthy because they protect us from the environment.
So I want to ask about another star's death, because Clint Eastwood's longtime girlfriend, 61-year-old Christina Sandera, recently passed away, and we're now learning that she had a heart attack that was listed as a cardiac arrhythmia. So Dr. Coley, tell us what is a cardiac arrhythmia, and is it common for women her age to die from it?
You know, I'm a cardiologist. I see women all the time dying from heart disease. #1 killer of women. 20% of women over the age of, you know, 55 are going to die from heart disease.
I feel like we
How
don't
is this
talk about
not
this
more
enough.
known?
I know.
It's crazy.
I mean, when you think of heart disease, even when we learned it in medical school, it's an old man's disease.
Right.
They had a picture of an old man with a cigarette in his hand, kind of clutching his
Eating
chest.
bacon.
Yes.
Sorry, I shouted.
You really did.
Well, they don't study women in the way that they should.
But that
They
had
always...
nothing to do with yelling.
Yeah, I know. I'm
eating
just
bacon at
angry.
Dr.
I'm
Coley.
sorry. The medical tests are always on men. I'm so sorry. Continue.
It's true. So all of us as women up here, the women in our family, we need to make them aware because education is key here. So what happened in this particular case is you had a heart attack, which is a plumbing problem with the heart. So you're not getting blood flow to the heart like you should. And that plumbing problem leads to an electrical problem with the heart, where the electricity of the heart freaks out. It suddenly just stops, and that's a cardiac arrhythmia or cardiac arrest. And that can be an instant death, and it can be very hard, of course, to get somebody back from that unless they get high quality CPR. So think about it like a pipe bursting in your house and it causes the electrical fuse to blow. That's what happens in your heart. And 80% heart attacks are preventable with the right risk factor management. So it's up to us to embrace
It's
that.
scary, but at least empowering that you can do something about it.
You can prevent it. Go see your cardiologist.
Yes.
Dr. Coley. Thank you for joining
I'll
us
see
today.
Tori and her bacon.
Yeah. Why don't you scream us into commercial, Tori?
DBL. I'm just kidding.
DBL Nation, follow Dr. Coley on social media at Pyle Coley MD. Also be sure to subscribe to her YouTube page. Plus, check out her podcast, Heart of Medicine, wherever you listen to your podcast. Thank you again, Dr. Coley. We always appreciate you.
Thanks, Doc.
What's that? What? You told me to do what?
Yeah.
We'll be,
And Dr.
And
Jackson.
Dr. Jackson. We'll be right back.
He's not a real doctor.
He's not a real
even a face,
doctor.
not a